Hi, I'm Dr. Natalie Marks, and thank you for joining us for the latest information and advice as we all navigate our way through the COVID-19 pandemic, presented by the Viticus Group, formerly WVC. Tonight, we partnered with Merck Animal Health, the ABMA, and the Student Veterinary Medical Association to bring you information and strategies for workplace wellness, both for active veterinary professionals and veterinary students. And of course, we want to hear from you. So jump in the chat, let us know where you're watching from, and please send in your questions for our panelists. Joining us tonight will be Dr. Jennifer Brandt, Director of Member Wellness and Diversity Initiatives at the ABMA, Marie Bucko, President of the Student ABMA, and we want to start right now with Dr. Elizabeth Strand, Director of Veterinary Social Work at the University of Tennessee, Knoxville. Dr. Strand, what challenges are veterinary professionals facing right now on a daily basis?
Well, I certainly think the challenges include simply the stress that everybody is feeling with the changes regarding COVID-19, of course. And in addition to that, or exacerbating that, is how that impacts the human-animal relationship, and then how that impacts how practice is unfolding. Things like, of course, animals being picked up from the cars and being brought in, separated from their owners, and all of the emotions that is associated with that. And then, of course, the financial concerns that often already existed with the human-animal bond and now are even more exasperated.
Absolutely. And with all of those challenges, especially in practice, there probably are quite a few of our colleagues that are demonstrating some signs that they're struggling with their own mental well-being. Can you talk about what that might look like to one of us working side by side with a team member in practice?
Yeah, I'm smiling because I think when we say it, we probably all recognize it in ourselves. So I think the first thing is to sort of say, how am I doing? And that is helpful in recognizing how other people are doing. So some of the signs that the struggle is active is people just saying it. I'm not sleeping. I'm anxious all of the time. People, I like to call it flipping their lid, where people that would traditionally be pretty patient and kind, all of a sudden are short-tempered and not as flexible as they used to be. Certainly increased in tearfulness, increase in anxiety, digestive distress, not being able to stop thinking about concerns for physical health, of course, and concerns for family and friends. Would all be normal and natural signs within ourselves and what we see in our colleagues as well. Yeah.
And if we're noticing that in a colleague, a team member, a friend, family member, I think particularly even in maybe someone who works with you that you're not particularly close to on a personal level, I think it can be challenging to start that conversation sometimes. And what is the right wording to approach perhaps a topic they don't want to talk about or even feel comfortable talking about? What do you suggest for us to be able to support our colleagues, support our village, and start that conversation?
Mm-hmm. There's a wonderful campaign, and the campaign is, it has the tagline, embrace the awkward. And I think that's one of the first things, is that you have a little stirring inside that says, I'm worried about this person. So that's the first thing you listen to. And then the next thing is that you embrace that awkward feeling of needing to ask them about it. So just recognize that it will not feel totally comfortable. And that doesn't mean that you're not doing the right thing. That's number two. Number three, you say something like, how are you doing with all of this? Just that, opening that open-ended question. Don't say, you're okay, aren't you? That's a yes/no question. Open-ended question. How are you doing with all of this? You can also say, I'm noticing that maybe you're feeling a little more down. Is that what's going on? How are you feeling? So you can also observe outwardly what you're worried about, and then be quiet and listen. Yeah,
And I think
that's the trick.
And that's hard to do sometimes, I think. Very good advice.
Yeah, embrace the awkward, ask an open-ended question, and then be quiet and listen.
So I think that a lot of us, and first I want to commend all of the viewers that are watching right now, because I think it's the first step in self-care, right? Because we need to hear this and see how we can do better for ourselves and for our profession and our colleagues.
Yeah.
But I think a lot of us, including myself, at times feel very isolated in this profession, because if you go home to a spouse or a partner or a family member who isn't in the profession, it can be really challenging to explain how it felt to go through a euthanasia, or how it felt to deal with a challenging client or case, or how it felt to perhaps have other mental health struggles that day. I think it's difficult also to explain to your village what ways they can best support you. Can you help us with that? What can we suggest to our support teams outside of practice to help support us when we're not at our jobs?
Yes, yeah. Well, I think the first thing is that all of us in the profession have to get very clear about what we actually need, when we go home. So sometimes I think we've gone through a really tough day, and then we arrive at home and we know we need something, but we haven't clarified what that is. And each of us is very different. Some of us need no talking. I need just a half an hour of no talking and get on the treadmill. Or I need for you to listen for a half an hour and give me eye contact, and don't give me any advice, and just tell me and let me talk about what happened. I need macaroni and cheese ready for me when I get home. So I think the first step is you've got to get really clear about what you need, and then try to communicate that need when you're not in the midst of it. So ideally, you communicate that need on a weekend or a time when you're off, ideally work, with your loved one, so that they know what is expected of them when it's not urgently essential. So that when you come home at the end of the day, and you can say, remember that conversation we had on Sunday? We're having it right now. This is the moment. I need macaroni and cheese. I need a half an hour on the treadmill. I need whatever it is that brings you a sense of comfort. And then I think support groups. So I think sometimes even just getting spouses and family members even together to learn what it's like to be married to or connected to a veterinarian, and help them support each other is really important as well.
That's great advice also. I want to talk now more just about our day in general. So, I briefly mentioned, of course, very well the challenges that we face at work, whatever that is, whatever type of veterinarian you are. And one of those challenges will always be dealing with euthanasia, and not just the impact that the family has, but obviously the impact it has on us, the veterinary team. Can you give us some high-level tips on how to best support ourselves through that process, and how we can help our own mental well-being stay as stable as we can when we have to deal with these very difficult situations?
Yes. So I think that the first step is to recognize that if it's a difficult experience to perform the euthanasia, that's normal. And number two, that you have ideally a buddy or two that you can reach out to say, that was a really tough one. A lot of times you have several, but there's one or two that get down into the heart, right? And so having those, I think it's about preparation, having those buddies in place, that you have a deal with each other that says, I can text you and say, I need to talk for 5 minutes about this euthanasia that I just helped a family with, or individuals with. Yeah. So I think just like we do prepping our family members, we have to prep each other as colleagues to be buddy systems for each other. Yeah. And then I'm a big believer in, check up from the neck up. I think embracing mental health care is a wonderful thing if we need it. And so, and don't give up if you don't like the first mental health professional that you connect with. Keep going until you find somebody you like. It's like a friend. You got to find somebody you like, you get along with.
And for those of us that, right now, quite a few practices have been working very long days, very hard, very trying days, trying to keep up with the stresses of the pandemic and maybe short staffs or, taking cases from other practices that may be closed. What are some things that we can do during our day to help our whole body stay as healthy as possible?
Yes. So hydrate, on purpose, once an hour, set a timer on your watch that is the check-in moment. So once an hour, you are checking in. Have I gone to the bathroom? Have I had enough water? Have I had appropriate food? Taking 5 deep belly breaths. And I'm a really big believer in shaking the body. It's a funny thing, but if you take a moment just to shake your body, it helps your nervous system let go of any kind of accumulated stress. It seems weird, but dogs do it. After you cuddle a dog, they jump off your lap and they shake, so we can do the same things for ourselves. And and then knowing if you need help, knowing in those check-ins, how am I doing it emotionally? And oh, you know what? That was a hard case. I need to text my buddy and have a phone call on the way home before I get to my family or my spouse, or to talk about that situation that I just had today. Yeah, every hour, once an hour.
And I love that you're giving us that permission, because I think so many of us feel, I don't have time for that. I don't have time for lunch. I don't have time for a bathroom break or a walk outside or whatever that takes. But it is just so important. If we're not our best selves, we can't be our best selves for our patients, our clients, and our teams and our families. So I'm definitely going to set my watch. I've got my water. I just need to set my timer. So Dr. Strand.
2 minutes. It takes 2 minutes. Take a deep breath. How am I doing? That's it.
I love that. I love that. I think that's going to help so many people. And I want to remind everybody watching, send us a quick check-in. Find out we want to know where you're from, and we would love to hear from you what your challenges are and any questions that you have for our experts tonight. So again, thank you so much for your expertise, Dr. Strand. We'll have you back in just a little bit to answer some of those questions. But right now, we want to turn to Marie Bucko. She is the president of the student ABMA and a veterinary student at the University of Wisconsin at Madison. Marie, as the veterinary students around the country are preparing to hopefully head back to school, as I hear perhaps sooner than we thought, what are the challenges that veterinary students are facing, especially those incoming seniors, in regards to their mental health right now?
Hi, thanks so much for having me. So you definitely nailed it. There are certainly some challenges that are facing veterinary students. And when we're looking at the students that are heading into their final year of school, through many conversations with them, there are a few main challenges that aren't exhaustive of what we face as students, but some that have really been brought up repeatedly essentially include, that lack of physical activity, sitting at a computer when they could be in clinics, and just an overall lack of motivation when, with the current environment. And at times it can be exacerbated, with that lack of structured schedule. But certainly, tapping into the worry of not being able to get into clinics quite yet and making sure that we feel competent when it comes time to starting in our new profession.
Yeah, so with all of those challenges just added on to just the challenge that veterinary school is in itself, what can you share in regards to what SAVMA has either been talking about or planning or working on to help better support the student well-being?
Sure. It's incredibly motivating to see how veterinary students rise to the occasion when dealing with the stress and the unknown. So let me answer this in a twofold way. So first, as you probably know, veterinary schools, they each have their own SAVMA chapters. And within them, they've taken the initiative to put together events, even if it's virtual. So for example, the University of Wisconsin normally holds a springtime WAGs for Wellness 5K event with dogs. And instead of canceling, they actually decided to make it virtual, encouraging any sort of physical activity. And even across the pond at the Royal Veterinary College, their SAVMA chapter holds Zoom yoga sessions with an instructor, and they host photography competitions. So veterinary students are incredibly creative and adaptive. And so the second part, on the national level, we recently released a series of posts from our executive board, which is made up of students from various vet schools, highlighting the 9 different pillars of wellness and tools on how to carry them out. So does that look like meditation with the spiritual wellness aspect, participating in activities, non-veterinary related, such as exploring outdoors, reading a good book, painting, things that we can do to really promote occupational well-being. And so if anyone's interested, I would encourage them to head over to our Facebook or Instagram pages at Student ABMA to get more tangible tips and see what works best for you as a student. And if you feel extra motivated, you can actually join us. Right now, we have an interprofessional virtual 5K where we're competing to raise funds for the CDC Foundation against the optometric, osteopathic, and physical therapy student associations.
That is awesome. That is awesome. I will be sure to join.
Good.
With all of those students eventually going to be colleagues of ours, what are some of the things that these graduating students and soon-to-be graduates are looking for in their first or second professional job and practice that is going to support their wellness the best that it can? There's obviously going to be a point where every student is going to be out there looking for the right home for them in whatever specialty or generalist setting they are. What are the students looking for? What do they need in regards to supporting all of those different forms of wellness?
I love that question. And right off the bat, the fact that you're asking it speaks volumes of our profession. And I think we can all agree that everyone feels supported in different ways. Some of those ways can look like a simple gesture. For example, one school did a great job in reaching out to both students and staff through goodie bags, just to show that they're thinking of them through this difficult time. And that can carry over into a new career. Another way is opportunities to expand learning outside of the school, like virtual internships, or simply just having a conversation with a student, acknowledging the stress that comes with school or recently graduating, and layering on a pandemic on top of it. This environment has been highlighting the uneasy feeling of incompetency and uncertainty, to be entirely transparent. So hearing the support from those in our profession would go a long way, and can be as simple as a text, email, or Facebook message in the form of an open-ended question, just as we chatted about earlier in this conversation with Dr. Strand.
Those are great pieces of advice, and I certainly hope that the profession shares in that, in your support. Within school, when you head back, I think you mentioned potentially this summer, there'll be some students going back into clinic setting. What are some resources that you have at school for those of us who graduated many moons ago that might be different now for the support of wellness, whether within SABMA or outside of SABMA? And maybe even if you want to talk personally, what is a resource that you would like to have while you're in veterinary school that might support you better in whatever way we've been talking about?
So you definitely asked a loaded question, and I think I can target the first one, and then we can kind of trickle out from there. And one of the points that you asked was what other programs SABMA has to support, new veterinarians or going into the workforce in that sense. So SABMA is focused on supporting veterinary students respectfully, and through that process, we aim to provide, opportunities and resources, whether directly from SABMA or in partnership with other organizations like this evening, to help prepare them as a new grad. And that has looked like leadership opportunities as officers and or committee members and officer positions within them to really hone their communication skills and team member skill sets, attending conferences like the Veterinary Leadership Conference in Chicago, SABMA Symposium, and the Veterinary Leadership Experience, just to name a few. And so from there, we encourage students to become ABMA members post-graduation, where they can join others in the early career community within ABMA. And hopefully we can really capitalize on the benefit of organized veterinary medicine to be able to partner together and lift each other up through those capacities.
So is there anything that the profession, besides the personal contact, that we could be doing more to support students in their overall wellness and mental well-being?
Great question. So I think if you know a student, simply reaching out to them and having that personal connection is super, super important. And having those open-ended conversations. As I mentioned before, everything has been online recently. And for this, whether it's, a first-year student missing out on labs, or a fourth or fifth year student in some schools missing out on clinics, or even our second and third year students that aren't necessarily going to be able to get their hands on junior surgery experience right out of the gate. We definitely worry about not having the competent skill set when it comes to clinics. And so if there's a creative way, that I know all veterinarians are incredibly creative, and the support staff that come with them, if there's a way that you can provide any sort of, maybe a GoPro camera or your camera phone, walking us through surgeries in a very informal way, having virtual clinics in a sense, or virtual internships, now that everything has been predominantly moved online. Those are just simple gestures that we know how busy veterinarians are and their support staff are. And so that speaks volumes to us. And it also allows us to learn alongside you through direct mentorship in a sense.
Hint, hint, right? To all of our colleagues out there, this is some great ideas of how we can better support our students. Marie, before we get to some questions, really quickly, what's on your docket as president of SAVMA?
Certainly, this year being stricken with a pandemic, it's kind of shifted priorities in a sense. My goal as president is to support our executive board as much as possible through leadership, in the sense of making sure that they feel supported, to connect with our House of Delegates, to ensure that we have an adaptive and collaborative and mission-driven agenda, essentially. I try to identify the end and common goals to empower our executive board and our students individually as much as possible. It's needed now more than ever, especially that everything has been online. We hope that whenever we get back together, we can continue this production like this and use lots of positive reinforcement. And so basically, this season has been one that has shown students can be incredibly resilient and adaptive. And I can't commend our students anymore. I wish I could probably do more if possible, to really commend them for being adaptive. And it's something that they can add to their tool set in moving forward. And I hope that through this pandemic and through working online with students, they can be reminded through our executive board and me making intentional efforts, reaching out to students more now to remind them how important each of them are, and how important each of them are, not only to our House of Delegates and to our profession, but to themselves. And they need to be reminded and give themselves grace through this time, because each of them are incredibly important. And I'm so, so grateful to be here to represent them.
Very well said. Thank you so much, Marie, for all that you're doing for the students with SAVMA. We know that our profession is in such good hands with people like you coming down the ranks and soon to be our colleagues. Again, if you're a student watching, Marie and Dr. Strand are going to be here to answer questions in just a few moments. But first, we had a chance to check in with Dr. Jennifer Brandt, Director of Member Wellness and Diversity Initiatives at the ABMA, to find out more about all of the resources that ABMA has available to help us to keep working on our mental wellness right now. And I asked her first about the origins of the Workplace Wellness Certification Program.
Sure. So the Workplace Wellbeing Certificate Program was really our effort to focus not just on individual level efforts, which have been prevalent in the profession, but how do we really address whole teams? How do we make organizations and systems well? So the Workplace Wellbeing Certificate Program is an online program that people can access in their own time, work at their own pace. It's worth 4 credit hours and comprised of 5 different modules. Creating a culture of well-being starts the program and lays the foundation. And then we focus on skills like giving and receiving feedback effectively, how to transform conflict and set boundaries, suicide prevention as part of the training, as well as diversity and inclusion as a vital component of a healthy workplace.
ABMA has been a champion of supporting mental health awareness and giving resources to our profession now for many, many years. Besides this certification program, what other resources does ABMA have for members in regards to mental well-being?
Yeah, again, so very intentional about our efforts to promote a healthy work environment. So we have things like standalone suicide prevention training that we offer online. We did offer it in person, but the current pandemic has put a little bit of a limit on that. We have a post-vention toolkit that's available that we created with the American Foundation for Suicide Prevention that helps provide a language for how to talk about suicide prevention and reduce suicide contagion. We have something called 100 Healthy Tips, low cost or no cost strategies that a workplace or individual could immediately put into play in 9 dimensions of well-being. We have a website, My Veterinary Life, that focuses on current students, new grads, and rising professionals in areas like well-being, career, and finance. And then we have wellbeing.org, which is a wealth of resources online, a quality of life assessment, and we have a page that's specific to resources for well-being that are specific to COVID-19.
So a plethora of resources out there for us, and we certainly encourage all of the viewers tonight to be looking at those and sharing with their teams. Now, Dr. Brandt, you've been heavily involved in the Women's Leadership Initiative. And obviously, with so many people dealing with challenges right now, and the profession predominantly being female or women focused at this time, they are certainly dealing with their own probably subset of challenges. Can you speak to that a little bit?
Yes, I think it's important to say too that, you know, women are not a monolith. And so when I speak about issues that are impacting women, I think it's also important to address the intersectionality of the experience of women who are Black or women who are brown or trans women. And there are a number of factors that may be impacting them differently. And one is that leadership continues to not be representative. So the policies that are made tend to perpetuate the inequities that we have in the system. So with that, we know that women are disproportionately impacted by the demands of childcare and the household chores that are escalating right now when children are not in classes. Women who are front healthcare workers have higher risks right now related to COVID-19. They are more likely to be laid off or experience a reduction in hours. It's really this intersection of economics, health and well-being, and healthcare systems that are coming about and impacting women and people in other marginalized communities.
And thank you for clarifying all of that group, because I think that's important to show that ABMA really is inclusive in all of that. But it's not just veterinarians or that other demographic that we've been talking about. Veterinary technicians and paraprofessionals continue to have challenges with working wages and benefits and acknowledgement within their own career paths. And so what can you speak about in regards to how the ABMA is supporting the veterinary technicians and nurses, and again, the paraprofessional teams within our industry?
Absolutely. I would say the veterinary technicians and the paraprofessionals are impacted by many of the same things that I listed for women and other marginalized groups. And so one thing that's been really important for us to be intentional about is making sure that the resources we are offering are available to all. So the COVID-19 specific resources are publicly available, and acknowledging the fact that technicians have a range of risks right now. So they may have reduced access to CE offerings and maybe worrying about how do they maintain their licensure during this time. We know that that's a population that may be more likely to have their hours reduced or be laid off. We know that that's the audience that will directly have more patient care, potentially handling of the animal, and certainly more client in-person contact. They're the ones going out to the curb to retrieve the animal, and yet PPE has been routed to the human healthcare professionals, so there's a higher risk potentially for safety concerns. And when we hear from our technicians, they say, there's this demand to meet the needs of the business, but without their voices necessarily being included and at the table. So part of that is continuing to remind folks that the technicians and the paraprofessionals need a voice at the table. Again, our offerings are specifically for anybody in the veterinary professional audience, so they can go on to our Axon resource page and find out, what do I need to do to be safe in my work environment? How do I advocate for my needs while I'm there?
I think that's very important, because there are many technicians and practice managers and assistants that I've talked to that don't necessarily feel that they have the ear of a management team or employer, and are worried about their personal health and safety during this challenging time. So it's wonderful to hear that those resources are available for anybody through that landing site. Dr. Brandt, we're glad that you're staying well and healthy, and certainly hope all of your colleagues at ABMA are doing so. We thank you for your service and commitment to the profession.
Thank you so much.
All right. So I'm so excited to get to comments and questions for Dr. Strand and for Marie. Before we get to those, though, quickly, Dr. Strand, I don't want to lose sight that so much of tonight has been talking about veterinarians, but veterinary technicians, veterinary nurses, and our paraprofessional staffs at practices around the country have similar, if maybe even more, mental health and well-being challenges in practice. Do you agree with that?
Yes, I mean, I certainly am so grateful for the question, because we're starting to now embrace, right, the whole veterinary clinic, and that is not just the veterinarians; it's everybody who contributes to making the clinic run, and so it's really a good, wonderful thing that we are saying all the veterinary nurses, all of the client services representatives, all of the assistants are facing very similar challenges with regards to the pandemic, feelings of security, financial ability to cover cost of living, and sometimes kind of feeling like, and I've heard it over the years, feeling like, what about us? Yeah. And I'm happy to say that there are, efforts in research. I've got some research colleagues that are starting to do research looking at mental health for veterinary nurses and more members of the team. And certainly services like Not One More Vet are opening the scope of the services that they offer to include the entire team, not just veterinarians. So yes, all of you matter, and need and deserve the same level of mental health care and attention that the whole team needs. Yeah, thanks for the question.
Absolutely. And I'm so glad to hear that this is a focus.
Yes.
Marie, we've got a question from Michael, also for Dr. Strand as well, but I think I'll shift this to Marie first. Mm-hmm. Michael wants to know, what are the top stresses that new grads are feeling with and dealing with right now? And what are they looking for from their potential employers to get help with these stresses?
That's a great question. Every season there's something a little bit different when going into the new workforce. Certainly this season, a lot of recent grads had to finish out their fourth year online with clinics. And so that can definitely feel a little uneasy. And certainly when they're heading into the workforce, whether that's practicing, heading into internship, academia, government, I think there's an overall consensus that regardless of where we go or where recent grads go into the workforce, having a sense of grace and patience with the new grads is something that I think can always be welcomed. We have this uncertainty of competency going into the workforce because of the pandemic, on top of already, being a new grad where students are feeling like, oh gosh, I'm finally getting into being able to call myself a doctor. I'm not sure if I should be. Imposter syndrome rises to the top quite often, and it shouldn't, because students, when they graduate, have the skill set that they need to start practicing or to enter in whatever area of the workforce that they're looking to go into. And so to have that reassurance in a way that looks a little bit different for every person, But having that reassurance from practitioners or colleagues in the profession to say, I'm with you on this, I hear you, you have nothing to be worried about, we're in this together.
And I know that you obviously being a leader with SAVMA and within your school, I'm sure that many students may come to you from time to time with concerns and questions and challenges, and you probably watch other students be support teams for your class and within the school. How do you see students best supporting each other right now? Is it Zoom meetings? Is it Facebook? Is it Instagram? How do people connect right now as students to sort of be that village for each other with these mental well-being challenges?
Yeah, so that is quite dynamic. I'm so proud of our veterinary students. They are incredibly resilient, and managing through this pandemic only proves this and how adaptable we are. And I really hope students can permit themselves to acknowledge and embrace that. Echoing back to the topic of mental wellness, we have each year an opportunity where we encourage veterinary students to unite together on what's called VetMed United Day to bring awareness to mental wellness. And it starts the conversation. And I know we're talking about that, and we're also talking about how do we keep in touch during this pandemic of everything being online. We definitely have a lot of online meetings. We have a lot of online happy hours. Keeping in touch through social media is something that has been, brought to the forefront. I hope by reminding students that we do have VetMed United Day, usually in April, that takes place around April 4th, having that conversation and starting that conversation on mental wellness and what that looks like, hopefully starts that conversation to say, it's okay to discuss this topic. It's not taboo. You're in a safe place to discuss it with anybody that reaches out to you, or perhaps we can be more approachable as students to our fellow colleagues and classmates, whether that's in our own school, in clinics, or at conferences that we attend online, or hopefully in person soon, to say that we're a resource, that we're available to keep in connected with.
That's a wonderful program. Dr. Strand, we have another question. How should we try to handle it if one of your veterinary team members has, I guess the best way to describe it would be sort of a meltdown at work right now, when we're getting overwhelmed, it's just too much and it's affecting everyone around? What is the best way to support and diffuse that situation to be basically the best team member that we can be when they're really in a crisis moment?
Mm-hmm. Yes. Well, I think when a person is in a meltdown, they are in a crisis, they're not functioning, that approaching them and saying, what's happening, what's going on, and listening is the first step. If it is in a public area, it's helpful to try to encourage you and that person to move into a private area. And then, sometimes just sitting in silence and allowing the person to cry or to express frustration for a period of time is just fine. It's very, very good to just simply listen and not try to fix it. But then it is important to start looking for what comes next and seeing what kind of status they are in terms of safety. And sometimes that means calling a local mental health resource. In a lot of communities, there are things called mobile crisis units, where you can call and talk to a mental health professional 24/7 who can maybe talk to the colleague privately and help to assess if they're safe or not safe, or what kind of services that they need. So I think it's really important, as someone who is attending to someone who is in such a crisis, for that person who is the helper to not feel alone themselves, and to know that they can call local resources, mental health resources, for help. And then certainly if a person, that's if a person is with you, in the clinic, But sometimes people are maybe not showing up for work, or they're calling you, but you're not near them. And I have to say that sometimes, a certain skill that I think all veterinarians need to have is something called the welfare check, where you call the local law enforcement and you tell them that you're worried about this person, you've reached out to them, you can't get in touch with them, and you need help checking to make sure that they're okay. And that can be a colleague, but sometimes we have to do that with clients too. If we're worried about their safety, they've expressed some concern, some statements of self-harm, that is a safe and good thing to do. It can be scary to do it, but it's an important skill. So I think the main message is that if somebody is with you and they are in a meltdown crisis, start with being present and then seek help from mental health professionals.
And on a sort of tangent to that, I think one stress that does happen in practice somewhat often is dealing with a client's mental well-being, especially in a euthanasia or a terminal diagnosis or financial challenges of wanting to do the best care but not being able to. And we're trying to diffuse a client. And so many of us obviously did not receive training in this when we were going through veterinary school on how to have that sort of ongoing dynamic psychology in the conversation. Can you give us a few tips on how best to handle when a client is in that position and you're in the room and it's you're kind of feeling a bit stuck?
Well, I think that being able to ask an open-ended question to the client, what do you need right now? Do you need, and let them tell you, I need to be by myself. I need to call my family member. I need to have time with my pet by myself for a few moments, or I need you to answer this question about what's coming next in terms of the prognosis for my pet. So asking that question, how can I help? What do you need right now? Is, I think, a good start. And then I have to be honest that, and you mentioned it, you sort of said, a lot, I will say that the younger veterinarians are getting more training in having these conversations. But, it's handy to have a social worker around, I must say, for those types of situations. That's why we're there. Yeah. It's because, there's only so much that a veterinarian can handle. You take care of the pet. You can't be expected to take care of everything. And so that's when it's helpful to kind of have a relationship with a mental health professional, or ideally if you have somebody in-house or somebody affiliated with your practice, that you can say, hey, can I connect you with this mental health professional? And there's some evidence a long time ago that clients who knew that there was a mental health professional available and that was not offered to them, they found that not positive. That it felt good to them when they were cared for by saying, we have these people that can support. So those are my tips. Ask, what can I do for you? And then if you need help, get a mental health professional to help you. Yeah, absolutely.
And hopefully in the future, we all are associated with social workers, because that certainly sounds wonderful to me if we would have that support at our practice too.
Yeah, that's our goal. That's our goal.
It is a great goal. It is a great goal. Well, it's so sad to me. We've run out of time for tonight, but on behalf of the Viticus Group, formerly WVC, we want to thank our guests, Dr. Elizabeth Strand of the University of Tennessee, Knoxville, Marie Bucko, president of SAVMA, and Dr. Jennifer Brandt. Thanks also to Merck Animal Health, the student ABMA, and the ABMA for partnering with us to provide this content. Please visit viticusgroup.org for more information. I'm Dr. Natalie Marks. Until next time, stay safe and healthy.